It was a night of songs and eulogies for the late Damilola Adeuya, a student of the law school Bari, Abuja. Dami, as she was known in the school, died after battling with chronic kidney failure. The students on virtually the Abuja campus of the Nigerian Law School gathered at the school auditorium to pay their last respect to the 25-year-old who pursued her dream to no avail.
Dami was somebody who had hope. Dami passed when hope was actually very nigh, like it was just almost there. And if there is another thing we need to learn is that we mustn't give up when hope is nigh.
I don't know, I was like, God, Dami, dead. Let her just walk up to me and say, no, I did not die. I am somewhere. Dami was a very friendly person.
Damilola touched each and every one of us in our own way. We thank God for our life. We don't own our lives. God has the final say. But in living our lives, what exactly are we doing? How are we living our lives?
Victor Adeuya, Damilola's father, explains what he went through trying to save his daughter's life.
We went through so many rigor as far as this matter is concerned, but we thank God. I cannot say how much I have spent on this. I sold part of my property. That is not enough. I have taken all the loans of this work, both soft and hard one, to ensure that she lived. But the consolation I have is that her spirit lives on.
The students believe that Damilola died due to inadequate facilities in Nigerian hospitals and lack of money to continue with her medication even after her initial kidney transplant at the Apollo Hospital, India. Even at the Nigerian Law School, Bari, the support and assistance available to indigent students such as the late Damilola Adeuya are very limited.
No, her case is one out of maybe 2,000 students. It was a very special case. We've not really had any case like that before. The management of the school, like most tertiary institutions, have what we call the Tertiary Institution Social Health Insurance Program, T-SHIP in abbreviation for students. So the exclusions include kidney transplant, it includes open heart surgery and brain surgeries.
It therefore means that Damilola may have lived to actualize her dreams if perhaps the scheme is all-embracing, covering all manners of ailment, including the cost of the regular dialysis, which she did 3 times a week since she joined the law school late last year. All these are pointers to the fact that the health system in the country does not understand the needs of the people. As Damilola Adeuya, the best lawyer we never had, dies with her dreams, we hope that governments and health institutions will intensify their provision of facilities and support to reduce the growing rate of unwarranted death in Nigeria. Obiorani, reporting for Signature Show.
Glad you're still with us, and this is the Signature Show. Well, just like that special report said, Damilola Adeuya died. And the question we're asking this afternoon is, why did Damilola die? Could Damilola's death, could it have been prevented? Could we have changed the story? Could it be possible that Damilola would still have been with us pursuing her law degree at the Nigerian Law School? Well, I have experts to interrogate what may have happened. With me in the studio, I have Dr. Pius Ame, consultant family physician at the Federal Medical Center in Kefi, Nasarawa State. Dr. Ame, you're welcome.
Thank you very much.
I also have Dr. Sylvester Akonde. Dr. Akonde is a health systems strengthening expert and senior health financing advisor at ABT Associates in Abuja. You're welcome, Dr. Akonde.
Thank you for having me.
Well, you've heard the story of the young lady, Damilola, so full of life. I wish you met her, so full of life, so determined. I remember the last interview she had with us. She said, I'm a clever person. I don't want to die. But she died. Could the end-stage kidney disease that killed her, could it have been prevented, Dr. Ame?
Considering our country and considering the situation that we have, end-stage kidney disease is not as uncommon as we think. Experts have said that about 10% of the Nigerian population have this disease.
10% of 180 million people.
Yes, yes.
That's a lot, yeah.
So
That's about 18 million.
That's staggering. That's staggering.
And one problem with this condition, basically, it's the end of a disease known as chronic kidney disease. The end-stage kidney disease is the end of a progression of a condition called chronic kidney disease, which is simply the kidneys, a condition in which the kidneys are not excreting the waste chemicals from the body and also excess water. So all of us, we should have normal functioning kidneys. So when these kidneys stop functioning normally, you end up with chronic.
What percentage will be normal?
Percentage of normal, anything above 90 to 95% function, we consider that normal. But by the time you have what we call a risk factor. Now, risk factor are those conditions and those states that push you to have chronic kidney disease. I'll give you an example. Something as common as hypertension. How many of us know our blood pressure? Other conditions like diabetes. And then in our setting, what we call glomerulonephritis. It's like an infection of the kidney. And, so these are conditions that can easily be detected and diagnosed in your local health.
But if my kidney starts going down,
yes,
would I know?
You wouldn't know. Unfortunately, chronic kidney disease in the early stage does not cause any symptoms. We call it asymptomatic. So you would not know until your kidney function drops down to about 20%. Now, when it gets to 20%, you begin to show early signs and symptoms.
What kind of symptoms and signs are we talking about here?
You'd begin to have maybe generalized body weakness. You could have, you get tired quickly. Also, swelling, body swelling, especially of the face and of the legs, of the feet. These are the common symptoms of early kidney disease.
So it's preventable.
Well, the goal of treatment, now we're talking treatment here of chronic kidney disease. Ideally, we should be talking about prevention, because as the saying goes, prevention is better than cure. So when we say prevention, we look at those things that cause chronic kidney disease. Make sure that you check yourself in your local health provider. Check your blood pressure often. Make sure that it's not elevated, and if your blood pressure is elevated, take the necessary medications. Also, check your sugar level, because diabetes is one of the things that can cause chronic kidney disease. Prevent it. But if you do have the problem. It must be detected early. By the time somebody needs dialysis, like the case of Damilola, unfortunately, it is already the end of the story. What you want is to catch it early when the progression to that end stage can be prevented.
Okay, let's come to Dr. Akonde. Could the death of Damilola been prevented?
In terms of the death being prevented, yes. And this is exactly what I mean. Dr. Ame just told us that it's a progressive disease. So meaning that if we had been caught early, it would have been halted in its progression, and perhaps we wouldn't be dealing with the issues of an end-stage kidney disease. He talked about a couple of risk factors, diabetes, hypertension, and all of that. And all of these things boils down to access to services early. And by services, I mean both diagnostic services as well as treatment services.
Health services.
Health services, catching them early. And one of the problems around here is that access to services is very poor. And this is because there are many barriers to access to services. In some instances, it's financial barriers. In other instances, it will be things around geographical barriers and even cultural barriers at times. Until these things are dealt with, folks will not be able to get access to early diagnosis that would have been able to pick it early enough, and more importantly, early treatment that would have halted the progression into the end stage in the case that has happened. And I'm sure you may have read about a concept called universal health coverage. That's something that Nigeria needs to get serious with. So if UHC was being pursued,
Universal health coverage.
Yes, if that was being pursued with all sense of seriousness in Nigeria, there would be less stories of, the Damilola situation that we just heard. People would have access to services when they need it, not just services, but quality services. And of course, again, it would have prevented anybody from going into financial hardship and prevented
one of the key elements of universal health coverage is health insurance. People being able to have a kind of a cover that makes it possible. If I wake up with a headache, I'm not thinking about where I'm going to get the money. I go to a health facility. We have the NHIS in Nigeria, and we have a couple of states trying to start what they call their own state health insurance schemes. What is the problem? Why shouldn't a Damilola have access to medical care? Cheap, affordable.
Right. So maybe we should backtrack a bit. So universal health coverage basically means that everyone having access to quality services without suffering financial hardship. And by everyone, it would mean irrespective of your religion, your tribe, or your socio-economic status. It's true that we have the NHIS in Nigeria, and in 2015, a memo was passed at the National Council on Health that sought to decentralize the NHIS and encourage states to set up state health insurance schemes. As of the last time I checked, close to 17 states had already passed those bills into law. So they have the laws, mandating the states to set up these health insurance schemes. Not many of them have taken off in terms of implementation. And it's due to one reason or the other. I can talk about one right now. You recall again in 2014, towards the end of 2014, the National Health Act was passed into law after over 10 years of a long-running battle. In the National Health Act, there was a provision made called the Basic Healthcare Provision Fund. Now, this fund is a pool of funds that has, alongside other sources, 1% of the country's consolidated revenue fund. And this fund is meant to purchase a basic minimum package of health services for all Nigerians. Last time we checked, since 2015, this has not been captured in the national budget. In fact, we're even more afraid that in 2018, it may not be captured. But there are a number of things, that are going on, that we are very hopeful, will result in its capture. But where am I driving at? Many of the states rely on this fund because 50% of that funds should come through the NHIS to the various state health insurance schemes, while 45% of this fund should go through the National Primary Healthcare Development Agency to help put in place, and revitalize effective primary healthcare systems, while 5% should go for emergency treatments. Now, the states have relied on this, and it's like a lifeline of some sort.
It's baffling, but that is the truth. Every day you tune to TV stations, you hear appeals about a certain kidney patient that has a challenge. Is it that even in managing this situation, that it is very costly to manage situations like that? I mean, buying the drugs, are these drugs, even when the transplant is successful, are these drugs affordable? Are they locally manufactured? What can be done to ease, the pain and suffering of people that have fallen to this disease?
This disease, unfortunately, does not have a cure. Once you have a diagnosis of chronic kidney disease, end-stage kidney disease, you are someone that needs dialysis. When I say dialysis, it's a procedure where someone is connected to a machine that does the work of a kidney. It literally washes the blood. So dialysis, depending on where you live, the cost of one session can be between 25, 50, 60,000. And it's, by the time you need dialysis to live. So each individual might end up with either a session a week, sometimes 2 sessions, sometimes 3.
As the kidney continues to go bad.
Yes.
The frequency of dialysis increases.
Increases, yes. So coming to what he was talking about, financial hardship. So let's say the person has the means to keep alive through paying for dialysis with money. A time will come when dialysis can no longer help and you'd have to have a transplant. And transplantation, fortunately, is being done in the country now, I hear, in Kano and in Ibadan and perhaps some other select places. But the costs of transplantation are still very high, upward of into the millions of naira.
And you need a donor.
And you need a donor. In Nigeria, most donors come from the individual's family. After the transplant has been done successfully, because transplantation can fail as well. It's a surgical procedure that can have complications, including the patient can die from the surgery. So if they survive that ordeal, we'll now talk about keeping the patient alive, because transplantation is taking somebody's kidney and then implanting it into your own to do the work of your own kidney. Now, when you do that, your own body begins to fight that kidney, recognizing it like a disease. So it attacks and attacks. So after transplantation, the person is surviving on drugs that push this attack, this immune response. So you need those drugs to keep the person alive.
Will this be for life?
Yes, unfortunately, it is for life. So you have to, there are several combinations and new drugs. The newer drugs seem to always be better, but they are always more expensive.
It's here that I have to thank both of you for, being part of the program today, as we try to look at what could have prevented the death of that very promising young lawyer.